There we go, that's much better. It's great to be here. I'm thrilled to talk to everyone today about our little topic around claims to care and the application of AI in this environment. As someone who sits across major deals and technology transformations, there's very few sectors over the next few years that will be impacted more than the healthcare sector as it relates to AI. We're at a pivotal moment where cloud-based systems, AI platforms, old school adjudication engines that we're still sitting on still happen to be around, but real-time data and the ability to collect data across those systems is becoming more and more real. And they're redefining the way that those tools can be used across especially the payer healthcare chain, not just on the back office side, but even more so every day around the consumer engagement and the clinical side. We're seeing a lot of different trends, one of which is the rise of what I'll just call the intelligent claims process. Although many of the claims systems that power the engines of our payers today are still sitting sort of in these archaic repositories, they're being layered and connected in ways that has never happened before. Our ability to extract detailed information out of those claim systems to do things like fraud detection, to do things like predictive analytics is dramatically different than it was even 3 or 4 years ago. In addition to that, we're seeing the member experience sort of coalesce, and we're starting to see members demand something more, something that more resembles the consumer type interfaces that they get with their banking systems, that they get with travel systems, sort of those digital first experiences, but with the added complexity of both the payer and the provider and the continuity that must happen across both of those systems. And lastly, there is a continuous cost to care efficiency, not only on the hospital system side, and Nishant did a great job talking about that earlier on the provider side, but also on the payer side. Someone gave me a statistic earlier today, which is, Cigna actually has more revenue than Microsoft has. And if you can bend that needle the slightest little bit, there's a massive amount of value creation that can come out of that. And so whether it's Medicare Advantage, whether it's Medicaid, or whether it's commercial plans, there's financial leaders who are carrying the pressure to innovate while also driving costs down. And that's not exactly the easiest problem to solve. So with every opportunity comes complexity. We have regulatory landmines we're all sort of stepping around. We have tech debt that's sitting on some of these older systems, and we have all of the demands, the member diversity and care demands that are taking place on top of that. So that's why our panel's here today. That's what we're going to discuss. We'll crack this open and learn a little bit about how different problems are being solved, whether at the strategy side, the finance side, the operational execution side. So let's dive in. I'm gonna start off, and we'll just go right into a little bit around digital tools, sort of being central to healthcare. It can mean anything to anyone. We say digital tools, so let's start there. Starting with all panelists, I'm going to throw this at everyone. We can go in any direction. What's been the most transformative technology initiative that your organization has embraced and taken upon in the last 3 years? And give us a little bit of color to what that looked like.
I'm happy to start. I'm Mark Biviano, and thank you for having me on the panel today. But I take it more from the delivery, the human side of it, where we're using technology to enable a very special part of the healthcare sector. A lot of people have not heard about the type of industry we're in. It's called self-directed services. So it's an alternative to a nursing home. It's an alternative to agency care, primarily for people on Medicaid programs. So let's start with somebody that has financial hardships to begin with, and they have a disability. And it could be age-related, it could be wheelchair-bound, it could be mental health, it could be children, a number of things that afflict them to where the quality of care is improved and the costs are lower if they're allowed to stay within their homes. So you start thinking ahead about how technology impacts that and how far it's advanced. It has a tremendous applicability in this space going forward. when I look at Palco as a company, our digital transformation started several years ago. The first thing that we had to do was to take our core administrative systems and make them cloud-based. And it wasn't just refreshing of the technology, it was how it was implemented, how it was structured, because our two primary clients are state governments and MCOs who serve this participant population. So we've really built a platform that's orientated to self-directed services, and more recently, we've started to incorporate AI technology with that interaction. And an example of that is and we've worked with LTI on this. In fact, if you think about somebody that has to interact, if you can do voice activation for simple tasks, and for us here in this room, we don't think it's difficult, but if somebody calls into a call center and it's related, because we do all the payment processing for these people because they become employers in their homes and they have a staff now. They may have one staff, they may have two, they may have 10. And when they do that, they have to train the people, they have to pay them, they have to enroll them. All things that, an 80-year-old person in a wheelchair that's blind has a difficult time doing. So we've just recently incorporated, chat AI into our system where they can call in and for simple tasks like, did you get my timesheet, which is the #1 call driver in our call center. Because what they're trying to ensure is that they're paid tomorrow or the next day, because many of these people are living paycheck to paycheck. So it's had a tremendous impact on that population. Just something that simple.
Manju, you see this across a lot of different companies, so aggregate that and pick one.
Absolutely. First of all, thank you. Good afternoon, everyone. My name is Manju. I head the healthcare business at LTIMindtree. We are an AI-first global system integrator. I'll probably extend a few things that Mark said, but since I'm a little different from the guys here, there is our organization, then there are all these clients that we work with. I'll probably answer this in two different perspectives, right? What we see with our client organizations, what has transformed the most, and I also want to talk about something that we as an organization are investing in that I'm excited about, for the future, right? Where it is heading. I think from our client landscape, the biggest transformation that we have seen is probably in the claims management process, right? What used to be a purely administrative process several years ago is now used to predict outcomes. We detect fraud and we do automate workflows. Everything happens on the or inside the claim system. So I think that's a pretty big transformation, and I think it continues to evolve. I'm pretty excited about that. Now, from an LTIMindtree standpoint, we have been investing quite heavily on systems like what Mark was talking about. One of the things I want to call out there is the agent, voice agents, right? With Matt earlier talked about the demand of the digital consumer, right? They're demanding more. The member base is expanding. So the contact centers of today will not be able to handle this load that's going to come up in the future. So I think the only way to scale up these contact centers to keep your experience up and also make sure that you're following everything or regulations and addressing the accuracy and everything would be to depend on AI and technology. So we have invested in a platform called voicing.ai, which in some ways replaces what a human agent can do. Free flow conversations and multiple languages and multimodal. Integrates with chatbot and so on and so forth. So I definitely am most excited about that. As it and we are already working with some of the customers to try this out. It's showing some very good results.
Well, so Rishi, we were talking about this in the dental space. There's probably not a better sandbox to be thinking about. How do we automate? How do we apply AI in a way where we can break some things, but we may not break too much, right? So talk to me about a little bit about how you're thinking of this. I know you've stepped into this role semi-recently, So what are the things you're focused on? What are the ideas you're focused on? I won't ask you what you did over the last 4 years. We can sort of focus on what you're going to do over the next 4 years.
Right. So for us at Liberty Dental, definitely the focus is more on promoting self-service and as much as possible automate, right? So on that end, apart from call center, we are also using call center AI for call containment, especially on member ID cards and easier flows, which can be completely handled end-to-end. One of the other good project that successfully went live last year was using Gen AI or augmented by Gen AI to generate the care plan, to provide a better care plan, which can aggregate all the data together, identify your barriers, risks to health, and provide real value to the members. That has been a great success for us, and a really something that we are all proud of, because earlier we were hardly able to manage the risky population identified by our clients. Now we are able to actually identify bigger population and provide much more value care.
I'm curious too. I'm going to get back to you on the care plan application in dental, because that's not something I've thought a lot about, but it's something I'm really curious about. So Josh, you've lived with some battle scars over the last couple of years. Tell us about what journeys you guys traveled, and at Scan, sort of what were the big projects you were looking to tackle?
Sure. A little bit about me. I'm Josh Goode, Scan Health Plans. I'm a senior advisor, but I was Scan CIO for 12 years, hence the battle scars there comments. Being a payer CIO is being a CIO is not an easy job, as most of us know. So, we really leaned into, Gen AI. So I think about, when, the revolution kind of happened with that. One of the things I did, I launched Emerging Technology Operating Model, where I put together a team. I brought in, someone that's basically a de facto chief AI officer that, worked horizontally across the organization. Worked across my business units, worked across my delivery team, setting our AI strategy, our governance, and then enabling those delivery teams. And it's been a very successful model. I mean, we've got, probably close to 1,000 use cases that we've been able to go through and enable with, AI, and, some very impactful ones. I mean, continuing the contact center theme, I think that area was one of the biggest areas that we were able to really, move the needle, where we deployed a Gen AI solution, and, there's capabilities like Agent Assist, where, that call is coming in, and in real time, that AI agent is actually feeding information to our live agent, on how they need to respond. And, if you ever worked in a contact center environment, you think about, how technology has been applied to it through the years. A long time ago, we had these disparate systems. CRMs came into place to consolidate some of that. Mm-hmm. And now we're in that next wave where, some of these calls, our agents literally, don't even have to touch the keyboard, where the AI is just, in real time interpreting that call and feeding the information. It does the note summarization, translate it, into different languages if needed in real time. So that really has moved the needle. And then, the care planning side of things, we've made a lot of improvements there. Scan has clinical delivery organizations as well. So just, summarizing medical notes and giving a summary to our clinicians, where they're not spending hours going through 20 pages, and doing ambient listening to the patient visit, and then, recording that and posting that note back in, have been, those are probably 3 or 4 of the biggest kind of wins we've seen from when I think about a digital transformation standpoint, in particular with Gen AI.
Yeah, those are great use cases. So one of the probably most overused and least understood words is interoperability in healthcare. So I'm going to go back from right to left, and we'll come back this way. But I want to start with the folks that are having to sit on giant adjudication engines and live with those. How are you thinking about interoperability, not only just across your claim systems, your enrollment systems, your care systems, which I think is important, but then all the way across to your EHR and your providers, and actually creating that end-to-end consumer experience from a member standpoint? So that sort of touches on the contact center theme, Josh, but it goes obviously a lot deeper. So talk to me about that.
Yeah, well, and you're hitting on a sensitive subject for me. I mean, I was at a conference at Miami a couple months ago, and I think I went on a rant on this for over 10 minutes. So I'll try not to do that here today. But we really struggle with interoperability from a healthcare perspective. And when I step back and I look at it, technology is not the problem. That's not our barrier. We have technology to solve for it. But if I look at ourselves as a payer, and then also as a health system, a lot of times I do not have the information I need on my member or my patient, and we have these data silos. It's not aggregated. And you guys have heard a lot of talk over the last day about we've talked a lot about AI, and you hear a lot of people say, well, the first thing you got to do is get your data in order. Well, from a healthcare and a health system perspective, our data is not in order. I mean, like I said, I've been doing this 28 years. We're marginally better today at exchanging data than we were 28 years ago. We still, we've taken an approach of standards and different versions of standards. And the sad thing is, you look at other countries and they figured it out. Australia's got a great model between a public-private partnership where, there's an opt-in model, your data is consolidated, you got a full longitudinal record. And I sit back and I look at those countries and I think about what they're going to be able to do with AI and how much better they're going to be in delivering quality of care because they've solved their data problem across their country. And just think about it. If you have a longitudinal record, it shows every blood test you had since you were a little baby, and you run AI over that, and you can see the family history, how you could predict and personalize medicine. So there's a big opportunity there. I mean, AI is going to be great, but we can't lose sight of some of the fundamentals to really take advantage of AI in healthcare.
Yeah, that's cool.
That's the abridged version. So,
Rishi.
So from IT standpoint, we are definitely focused on making sure it's FHIR based, which is the CMS guidelines around that, or implementing more open APIs to make it easier. Because at the end, as Josh mentioned, it's all about how are you making the data available between all your different systems. So the focus is mostly on either in-house open APIs being built or go with FHIR standards.
I'll shift it a little bit for you, Manju. From your viewpoint as a partner, right? You see this across the board in volumes that others don't see this in. Where do most payer organizations underestimate the complexity of integrating AI and analytics at scale? What do you see as the big barrier most often?
Sure, and I think it probably goes back to the same topic. I think the biggest hurdle in my view for a quicker digital transformation is lack of data interoperability, right? So I think that is one area where we've seen several organizations underestimate the effort it takes, the complexity it has. I'll give an example. With the CMS interoperability mandate that's due in a couple of years from now, not even a couple of years, right? Less than 2 years now. We still have customer leaders that say, "Oh, we have 18 months. We're going to think about it." Probably in 26 or later 27 or whatever, right? So there is a lot of underestimation of the effort and complexity behind interoperability. So I think that is one big piece. The second I would say is a related topic is the importance of data governance frameworks. A lot of these organizations lack these frameworks, which is what leads to a very, very difficult transformation that they go through. And maybe a third one I'll call out is the investments needed in infrastructure, because now we're talking about like yesterday I think Brian was probably talking about it, right? You cannot solve tomorrow's problems with yesterday's logic and infrastructure and all that. So this needs a very different infrastructure, more computation, more power and more storage and so on. So I think a lot of them hit that roadblock when they realize, so they have a plan, they have everything going fine, but they realize the infrastructure is not there to support it, right? So I would say those 2-3 things that I've seen them underestimate.
Mark, staying on the topic of interoperability, the populations that you end up serving interact both with medical and non-medical systems alike. So talk a little bit about how you guys deal with that and talk about how you solution for that.
Right, and definitely there's interoperability at the systems level, but it is also the personal level. And I can remember attending a conference in Memphis, Tennessee. Josh and I were talking about this. When I first got into healthcare IT in the mid-'80s, and it was a very much presentation like this where a doctor got up and he started talking about the ability to develop an electronic medical record, right? And one of the
I've heard of
examples.
those. I've heard of those.
Yeah, you've heard of those, right? Still building it. It's funny. And that was really inspiring to me as somebody new into healthcare IT, and dealing with hospital systems, is could that really happen? And one of the examples he used, riding in an ambulance and you're sending data right to the hospital directly, and how that's important. Well, as I apply that to our industry, when I say is interoperability also at the personal level, because our participants that are on our program, they have to deal with their employees now. They have to deal with Medicaid and state agencies. They have to deal with their MCO. They have to deal with their caregivers. They have to do, and working on trying to hire and employ people. And so there's all and their doctors, and there's all these types of people that they have to interact with. And if we can provide solutions like Palco's providing, with artificial intelligence to make their life easier. That information could start at the time of their doctor's visit, because you want to ensure that they're doing the things that are necessary in their life. Is their food supply being taken care of? Is their drugs being taken on a regular basis? Are they getting the physical exercise? All information that, from a predictive standpoint and systems, that can be automated much simpler than back in the mid-'80s now, obviously.
Now, let's shift the topics a little bit to the cost side and the value side, right? Value-based care, we hear a lot about that on the payer side. But just to all panelists, maybe Josh will start left and we'll come right again this time. Talk to me, is the current reimbursement landscape ready to support sort of a digital-first model? I mean, payers and plans dependent on those reimbursements, forecasting and financial accountability. Talk to me about how the systems are accounting for that financial reimbursement tracking and the value that can be derived from that.
Yeah, so as a system overall, we're still struggling with it. You hear a lot about value-based care, and certain pockets of the country, we do value-based care pretty well. California here, we've done value-based care for a long time. Our systems are designed for it, but as you go to other parts of the country, the model is still, reimbursement is based on utilization. And I think about, applying technology to that, at least for me, and obviously I'm probably a little, jaded coming from a leader in value-based care like SCAN, you can really apply technology to that value-based care because, at the core and the premise of it is preventative medicine, which is, how do we get closer to our member? How do we get closer to our patient? How do we stay engaged with them, more actively so that we're preventing them from, getting admitted into hospitals or what? So there's still, a long way for us to go. One of the things we've been doing at SCAN is, expanding nationwide, and we've had to shift our model away from value-based care in these other markets and go in a fee-for-service model and really try to convert these providers over to value-based care because their systems and their operating models are really not prepared for them.
More broadly, from a financial perspective, Rishi, we'll come back this way. How are your teams balancing the cost discipline side of this versus the sort of push and need for transformation? I'm not seeing the direct correlation of AI to ROI yet. I don't see either of those two things necessarily, immediately delivering or deriving value. How do we maintain the cost discipline and still drive the value going forward? And this is probably one we'll close with because I think we can open this one up with all the panelists, but talk to us about that and we'll move to the right. Mark, were you going to say something?
Yeah, I was going to say, from our perspective, what we see is particularly with state governments and MCOs, there's always cost pressure. And especially MCOs, they're typically getting paid a cap, right? So their margins are very slim. So anytime you can bring a technology, new process that is going to save money, but at the same time, they have tremendous pressure from state governments to deliver the quality of service, right? And because again, we're in with disabled people, very high profile from a political standpoint. If they don't get a paycheck one day, they call the governor's office, right? So there's a lot of tremendous pressure to perform services, but they have to maintain their profitability. So there's a lot of pressure on us as vendors to keep reinventing ourselves with new technology, things like with artificial intelligence that can bring us. When we look at looking at claims data, how do we analyze that? Do that people really need some of the testing that they went through? based on some analysis. So there's tremendous upside, I believe, in AI. It's not quite there yet, but it's coming.
Rishi, we got 1 minute. Jump in.
No, I think it's definitely has to be data-driven, right? There is a lot of parity in the industry today. Like value-based care is successful in some pockets, but not everywhere, right? And that's because the lack of data there then. Similarly, preventive care is also booming a lot. Same reasons. So I think, and that's why you see so many companies coming up with population health management and areas like that. So there's definitely a lot of room to grow.
Yeah, I don't think we can say that we've reached the genesis of cost efficiency on the payer side. I think that with a high degree of certainty, there's a lot of efficiencies to be gained, and I have no doubt the next 2 or 3 years will be filled with all sorts of opportunities with panelists like this are the ones that are attacking this problem. So we really appreciate the panel joining us today, appreciated this discussion, and look forward to meeting you guys over the next couple of years as some of these ideas come and become real. Thanks, everyone.
Thank you.